October is Breast Cancer Awareness Month, and while prevention and early detection are always front and center, there's another story behind the care women receive after diagnosis. AtlantiCare's Women Oncology program is redefining how that care is delivered. Joining me now is Dr. Yoon-Flannery, fellowship trained breast surgical oncologist and chief of women's oncology services at the AtlantiCare Cancer Care Institute. Thanks so much for joining me. So tell us about the Women's Oncology program, Dr. Flannery.
Thank you so much, Robin. I'm really happy to and excited to be here. Our women's oncology program really stemmed from the fact that women are really the ones that make a lot of decisions, but maybe not get a lot of the attention. We tend to put ourselves on the back burner, take care of the rest of the family, children, husbands. And so we've decided to sort of put us on a pedestal and focus on treating each woman as the person they are. So we don't treat them just based on the cancer alone. We prioritize to make sure to expedite all of the workup leading to a potential diagnosis, but also making sure that we're treating them appropriately as quickly as possible. You know, a lot of women get a lot of anxiety from just involved with the whole process. And we obviously have this program that will allow them to get taken care of in a holistic way and not fall through the cracks.
So many women start with a breast concern, but then that leads them into other care. Tell us how that works.
You know, after imaging studies are done, it may lead to a biopsy or some sort of a surgical procedure, depending on what the diagnosis is. And we look at the patient again and really prioritize to make sure that we're getting to the treatment as quickly as possible. And then aside from that, there are so many other things that come as a patient after the fact that, you know, a lot of the times can get missed. And so, you know, we really value nutritional counseling. We value exercise therapy for all of our patients. If patients need any sort of, they have needs from a social work perspective, our program has all of these components in place to really get them to where they need to be.
That's fantastic. You treat the entire patient, and you are known for using advanced, less invasive breast surgery techniques. What are some of the latest innovations?
I do a lot of nipple sparing and skin sparing mastectomies, a wireless localization where women don't have to be tortured using a needle placement the day of the surgery. I actually also have developed a technique where we're able to perform a mastectomy for certain patients that can go home without any drain placement. You know, if you talk to anybody who's had a mastectomy, one of the biggest complaints that patients have, and rightfully so, is the pain and the anxiety that's caused from the drain. So I'm able to actually forego that in certain patients.
Thank you so much for sharing this important information on this Breast Cancer Awareness Month. Dr. Yoon-Flannery, Chief of Women's Oncology Services at the AtlantiCare Cancer Care Institute. And you are living well with Robin Stoloff.